I had the pleasure to interview Sandy Ryan, who has been an occupational health nurse for 4 years. She has a BSN and her nursing background includes working in outpatient clinics, urgent cares, and specialty departments. She feels that her experience in urgent care is what has helped her as an occupational health nurse. Her current employer does not require for her to be certified in occupational health, but she is certified in Department of Transportation exams, breath alcohol testing, and spirometry. She has also taken additional courses in workers' compensation law and risk management. Her duties include pre-employment physicals, chest x-rays, EKGs, audiograms, spirometry, collection of urine drug screens, and breath alcohol test. She maintains logs for bloodborne pathogen exposures, monitors patients' authorizations and compliance of appointments, reviews work status, and modifies work status. She currently manages 150 patients who are under additional care. A care coordinator assists her in ensuring that they receive authorizations for additional specialty care, such as physical therapy and orthopedics. Sandy manages her employer's workers' compensation injuries and employees her company contracts with that require pre-employment screenings, pesticide monitoring, and workplace injuries. Kern County's three largest companies are the state of California, agriculture, and oil fields. The workers she most commonly cares for that work from the state of California are correctional officers due to bloodborne pathogen exposures, as well as contusions, back sprains, etc. The most common work injuries from the agriculture workers are pesticide and heat exposures. Lacerations, sprains, strains, and heat exposures are the most common injuries from oil field workers. From the cases she has encountered, she states that the most common injury in workers is their back, regardless of employer or occupation. She states she also has workers that are out of stress leave and they are followed by mental health. She follows up with them to verify that they are keeping their appointments and following the recommended plan of care. Unfortunately, Sandy has not had the opportunity to provide education to employees, but has had the opportunity to tour the facilities where they work to get a better understanding of their working conditions. She also states that if she sees a pattern in work injuries, she makes recommendations on how to improve the working conditions. For example, she had several employees coming in for lacerations from cans. She advised the company to change to a different kind of can opener, and the rates of lacerations from cans have decreased. Her main difficulty in her position is being the middleman between the patient and the employer. The employer always wants the employee back to work as soon as possible without any restrictions, and usually the employee wants to be off work. She states that another difficulty she experiences is that with workers' compensation, employers are entitled to information that affects their rates. They are allowed to have the diagnosis and the work status. She states agriculture companies have a high insurance premium, so they want to keep days off to a minimum and would like to keep everything a first aid visit. When Sandy first started her position, she felt pressure from the employers to keep as much as possible as a first aid visit, but has established boundaries and has discussed with the employers of addressing the problem appropriately to avoid any future complications in the worker or the company. She said she has also had workers try to claim a workers' comp injury when they have injured themselves doing some kind of activity during their own time. Another difficulty she encounters is when a field worker should take time off work from a work injury and they are eager to return to work. She states field workers are paid by hours worked, and she has to reiterate the importance of taking care of themselves to avoid the injury from progressing. She states that it is important to be vigilant to ensure that she is giving the appropriate care in the best interest for the worker and the employer. Sandy enjoys her job because it is fast-paced and she does not get bored. She enjoys doing preventative screenings as well as taking care of workers with acute injuries. Sandy states that before taking this role, she was not aware of the significant impact workplace injuries are to the employer's bottom line.